it's been quite a week when it comes to the, fundamentals of biomedical research, Caitlin. And I want to start here with RFK Jr.'s announcement that he wants all new vaccines to be tested against placebo. So, Caitlin, if you can give us a sense of like, what does this mean? Because I think for a lot of folks listening out there, they're like, wait, aren't they all tested against placebo anyway? So I think it'd be worth just sort of sharing how we think through how to test vaccines and why.
So a lot of our vaccines are tested against placebos, like saline, for example. When we have a brand new pathogen, so COVID-19 or RSV vaccines, this is really important in evaluating safety and efficacy. However, this is where the kernel of truth comes in, is that some vaccines haven't been tested against a placebo, but rather against another vaccine. Scientists do this when they, one, combine vaccines, so our kids get pricked less, to change strains like we do with COVID or flu every year, or develop a next generation vaccine. And these are not placebo tested. They're called bridge studies, which basically allow scientists to see if this new vaccine or a drug is as good or better than that original vaccine that went through this placebo clinical trial. If it's not as good or better, it just doesn't go to market. And so how I envision this is like building blocks, right? Advancing from this foundation rooted in randomized placebo trials, and then advancing incrementally on top of that strong foundation. There's two reasons why we do this way. One is ethics, right? We cannot withhold known protection. In other words, we cannot just give someone a placebo vaccine if they volunteered for a clinical trial, if there's already a better alternative than getting the disease in the first place. I like to compare this to, for example, car seats, right? If we're testing a better car seat, we're not going to get half the kids no car seat at all, because we know that that's just not safe. It's just not ethical for scientists and physicians to do. And then the second is feasibility, right? Some vaccines like flu are updated yearly to match the circulating strains. And these are just very small tweaks. They're not new full products. And we just don't have time for a randomized control study because the virus just mutates too quickly. And so that's where we're landing with placebo-controlled vaccines and drugs. And I really don't think RFK can do much in this space. I mean, this is already really top-notch research.